As people continue joining, I'll just get us started with a few brief remarks from MNN's perspective before we get into the real substance of this webinar. So my name is Claire Ladd, and I'm the Programs and Services Manager at Massachusetts Nonprofit Network, MNN. Thanks so much for joining us today. I'm just going to go over a few quick housekeeping items before we dig in. The recording and the slides from today's program will be emailed to you afterwards, so just please keep an eye on your email for that in the next day or two. If you have any questions for the presenters during the webinar, you can definitely submit those via the Q&A function in the Zoom webinar. And you can also drop any logistical questions or questions about MNN in the chat, and I can respond to those. I also want to give a little background about us here at MNN. Our three goals are to strengthen the nonprofit sector through advocacy, public awareness, and capacity building services. And in partnership with our affiliate members, we offer these regular webinars as part of our capacity building efforts. So please stay tuned for future topics and let us know if there's any topics you'd like to see. Our efforts are made possible by our more than 600 member organizations. So thank you to those of you who are members for your partnership. And if you have not yet joined, but would like to learn more about various member benefits, such as cost savings, networking opportunities, please visit massnonprofitnet.org/join. All right, today's webinar, it's titled Doing More with Less, Optimizing Employee Benefits in Uncertain Times. And the presenters are Eric Gulko and Blair Booth of Innovo Benefits Group. I'll hand it over to them to get started.
Thank you, Claire. Thank you to the Massachusetts Nonprofit Organization for hosting us here today. We really appreciate it. Innovo Benefits Group is a employee benefits brokerage firm and fractional HR firm. We're headquartered here in Concord, Massachusetts. We're actually one of the largest, if not the largest, privately held benefits firm in this area. And I'm really excited to speak with everybody here as nonprofit organizations. We're not nonprofit, but we believe in the triple bottom line, looking at our profit margins, but also our impact on the community, our impact on the environment. We have many nonprofit clients and partner with a lot of nonprofits to help our community. So we really enjoy working with nonprofits and educating nonprofits. So this is a natural fit for us to have this conversation with you. If you want to check us out, you can look below. We're on LinkedIn, Employer. You can Google us if you like to as well. Let's go to the next slide, Blair. So our speakers are myself. I'm the founder and president of Innovo Benefits Group. Been in the business for longer than I'd like to admit. And again, I really value our nonprofit clients that we work with because of their values-based approach to employee benefits. It's something that's unique to your industry. We don't see that necessarily across the board. So you all are a unique group. You still have a lot of challenges. We'll talk through some of those today, but you're always coming at these problems with thoughtful, holistic points of view. It's one of the reasons I really like working with nonprofits. And then we also have Blair Booth here. She's the brains behind this whole thing, and she's our senior benefits consultant at Innovo, and she's going to be walking through some slides here as well. All right, we got a lot to go through, so let's keep moving. I'm going to start. We have various polls through the presentation just to keep people engaged a little bit. So let's start with the first one. Okay, we're just going to let people answer that. How many employees within your organization? And this just helps us understand who we're talking to and how to customize what we're discussing through the rest of the hour.
Responses have slowed, so I'm going to end and share the results.
Okay. So it looks like we have a nice broad set of folks. A lot of small groups under 25, but a fair amount over 25 and a few over 100. So a good broad spectrum. We'll go forward from here, Blair. The nonprofit landscape. What's going on in Massachusetts and federally? Obviously, we have uncertain times. We look at it through various lenses. Number one is budget. I'm not telling you all anything you don't know, but with a lot of the federal actions that are happening, there are direct impacts in the nonprofit space, both with grants and funding being slashed, both directly, but then also indirectly. And so we have to. I see many organizations that are creating two different budgets. One if things are stay the same, and a separate budget if things are cut quite a bit. So that's a imminent problem that many NGOs and nonprofits are facing today. Secondly, we've got a lot of other legislative activity going on, both at the state and federal levels. We'll get into that in a little bit in more detail, but oftentimes, especially if you're a New England-based or Massachusetts-based organization, the legislative activities might be going often in opposite directions. So the federal government may be cutting benefits in some ways and perhaps offering less protections. And then the states, especially a state like Massachusetts, is at the same time trying to protect additional benefits, maybe add some more. And so we have these dual efforts happening and a lot to follow through federal and state action. And then layered on top of all this, we have a lot of uncertainty in the healthcare market in particular as it relates to costs. We just saw the in Massachusetts the carriers submitted to the Department of Insurance a few weeks ago their proposed rate increases for 2026, and they averaged about 13%. So costs are being driven in large part by the cost of health care and the costs that hospitals are facing and doctors, as well as a lot of drug costs increasing, primarily and notably through the GLP-1 type drugs like Ozempic and Mounjaro driving up prices. So we have these various areas of pressure converging. And so that leads us to having to discuss, well, what do we do about these things? How do we best manage it? When we look at your sector in particular, we have quite a few nonprofits in Massachusetts, almost 30,000 nonprofits. And we have about 18% of all private sector jobs, almost one in five, are with nonprofit employers. So this is a big part of our economy, and a lot of families are relying on you all to help them guide them through this uncertainty. And they serve every community, food security, housing, the arts. So, and I would also say from our work with nonprofits, these are organizations that often can't easily shift and find other sources of revenue. So if something gets cut, it's not as simple as say, well, let's focus on this other area of business and try to grow there. It's much more difficult to turn that ship. So the nonprofits in this state are widespread and particularly vulnerable. In terms of the finances, when we look at revenues and expenses, what struck me on here is that three-quarters of nonprofits in Mass operated on budgets of under $1 million. So there's not a lot of room to maneuver. There's not a lot of fat in the budgets typically. And as costs continue to rise, upper single digits, if funding remains flat or gets cut, um, there's not a lot of room to maneuver. And while some nonprofits have tremendous assets, some of the largest universities and so forth, most nonprofits are not in that position. So when we look at how to do more with less, we often we often look at it through various pillars, especially for nonprofits. Number one, mission. You got to start with what values are most important to your organization because your benefits are often a reflection of your values. And so if your values include taking good care of your employees, trying to remove wherever possible financial difficulties as it relates to healthcare, if your philosophy is to offer at least as rich benefits as the market, if not richer, because perhaps your compensation isn't as high as it might be in the for-profit sector. So maybe that you as a nonprofit say, well, we got to offer relatively robust benefits. We want to have freedom of choice to see who we need to see as far as providers. So mission and your values is somewhere where we really want to start. And then you look at your demographics. Who's working for you and what are their needs? Because a 22-year-old fresh out of college might have a different need and want compared to your 50-year-old with a family and looking at what they need or want. So it's important to look at your demographics as well as, of course, the budget. We need something that's not short term. You need to put in place solutions that can be managed over time. We always talk about multi-year benefits management. So we're not just looking to jump from carrier to carrier to carrier just to save a few bucks. You need to take the long view in mind and make sure you can manage the budget over time. Compliance is something that's coming up over and over again on the federal side, especially the state side. Everything we do, we want to make sure we're avoiding penalties and we're doing things the right way. We stay ahead of requirements and try to proactively keep ourselves out of trouble. And then lastly, especially in the nonprofit space, often benefits are run by business offices. They may not be full-time HR people, or if they are, they may have many employees to support, more than you might see outside the nonprofit space. So whatever we do, we want to scale your support and not overextend. So whether it's making sure you don't overextend in the projects that you're managing, the types of benefits that you're managing, and or as we'll talk about later, maybe using some fractional pieces from other folks, outside vendors, to help manage benefits for you. That's something to keep in mind just to manage your capacity, because whatever you put in, you don't want it to just fizzle after a year. I always think about those big wellness fairs. People put in all this time and effort, and they put a big wellness fair together, and then they don't have the resources to keep it going multiple years. So capacity is something to keep in mind. Okay, next poll.
Sorry, I just launched it now.
So when we look at these pillars, mission, demographics, budget, compliance, capacity, which would you say is most important to you and most difficult to manage or balance? And I know you might want to check all of these, but if you were to pick one, which one would it be?
All right, looks like responses have slowed, so I will end it now.
Wow, budget, three quarters, clear, clear, clear. Second is capacity. Those are related. Budget impacts how many people you can manage. Budget impacts what you can offer and how you manage those renewals that come in. So we'll focus a little bit on that and try to give you some ideas, just so you know what else is out there. Okay, let's keep going, Blair.
Awesome. So thank you everybody for having us today. So that poll was a nice segue into what we're going to talk about in these coming slides. So we're going to break down each one of those a little bit more. You may find more benefit in the budget and the other ones that you selected, but we're going to walk through all of them. So the first step in your benefit strategy in many business strategies is to identify and determine your organizational goals and values. I'm sure you all know that. So you want to ask yourself and your team, what does our nonprofit stand for? What drives our work and our culture? And most importantly, which one of those values do we want to be reflected in our policies and benefits? So when you clearly define your organizational goals up front, whether it's equity, transparency, community impact, or retention, you can create a strong foundation for aligning your HR and benefit strategies in a meaningful way. As an example, if equity and retention are your top priorities, your benefit strategy might include an expansive medical plan, pair with a health literacy tool, which helps ensure all employees understand and can access care equally. You might also consider a tenure-based contribution strategy where employees who stay longer receive a higher contribution strategy, or a higher contribution rather, which will reinforce your retention goals while maintaining a value approach. So making sure that you are, understanding what your goals and values are is really going to be the top priority when looking to be strategic and about adding new benefits and making sure that your benefits all align. So once you have your goals and values identified, it's good to look at the full picture. So you'll want to build out a strong foundation with your core benefits. That's always the best practice. So if you look to the far left here, we've got our foundation of core benefits. So once you've got a good foundation built out, you've got all of those benefits where you want them to be aligning with the goals that you want them to, you can start to look toward the right on the spectrum. So enhancing your core benefits with voluntary benefits or employee well-being or additional financial benefits. So really, as employees are looking for new roles and things like that, the core benefits are going to be most important, but the ones that you add on in addition to that are really going to help strengthen that. Here we've got a list of mission-aligned non-traditional benefits and HR policies. And the idea here is to really complement that core package that we talked about in the first place. So once you've got your values and everything identified, you can really start to look at these and say, okay, which ones of these policies and benefits do we think are really going to help match what we have going on for our core benefits? So you'll see a lot of different things here that aren't necessarily insurance, and that's okay. The insurance benefits are great, but you also want to make sure that your culture is rounded out with HR policies that match. Okay, so we've got another poll here. So this question is, how well do you feel your current benefits align with your organizational values?
Okay, it looks like just about everybody has responded, so I'm going to end it now.
This is great to see. I would expect this from a room full of nonprofits. I think it's great that you've all identified your goals and organizational values, and it looks like everyone's doing pretty well with aligning those. We've got a few outliers, but hopefully some of the things that we talk about today will be nice takeaways to help you get to the point where you want to be. Okay, so moving on, we're going to talk about tailoring your benefits to your people. So this is that demographics pillar that we talked about. So right now we're working in a time where there's 5 different generations in the workforce. So we've got the silent generation, the baby boomers, Gen X, millennials, and Gen Z. So our teams really aren't made up of, one single generation. We've got racially diverse people. We've got unique family situations, employees that live all over the country. I think the one great thing that COVID did for us was allow for us to hire outside of our geographic locations. So we can hire across the country for talent, which is nice. And all of our employees have different needs and expectations. So when you're looking at your employees, you'll want to do a demographic analysis. It can be non-official if you want it to be, but just really understanding where your employees lie. As Eric mentioned earlier, employees that are younger probably don't value the same things as your older employees. And so really trying to understand what those things are before adding benefits in is going to help to make sure that your employees are engaged and interacting with the benefits. So here we've got our benefits valued by generation. And so this right here is just intended to be an example. So when you look at national benefits research, we know that each generation tends to prioritize different aspects of a benefits package. So there's areas that may overlap, but mostly preferences are going to shift by age and life stage. So for example, younger employees, especially the Gen Z, may be more focused on mental health, their student loan reimbursement, or flexibility, while baby boomers might prioritize comprehensive medical coverage, long-term care, retirement benefits. Caregiver benefits are another thing that I'm seeing growing in popularity. There are a lot of employees that are in that sandwich generation that are taking care of their parents and also their children at the same time. And so those caregiver benefits are becoming more popular. So when you take a look at this, you can really see where there's some variation. There's a lot of things that you could easily implement that would touch all different generations. But if your generational workforce is mostly made up of Gen Z, you probably aren't going to go towards the silent generation value benefits. So turning your insights and data into strategy is where it all comes together. So when you overlay what your employees are asking for with your mission and operational reality, you can find your sweet spot. So that's really where we're going to focus our strategy, prioritizing changes that matter to your people to strengthen the culture. So the idea here is to not guess what your people are looking for, ask them, and then compare it to the broader industry benchmarks to see what competitors are doing. So once you've got all the data from your employees by, employee surveys or by asking them, or just by looking at your demographics and your where employees' ages are, you can really start to put those things together and build out a nice strategy. You don't want to offer benefits that aren't going to be impactful, that aren't going to be engaging for employees. All right, pass it over to Eric here.
Okay, cost saving benefit ideas. So these are ideas we'll get to right after this poll. I know it's important for the budget, so we'll walk through a few ideas that we see out there that want to make sure you're understanding. But first, let's introduce the poll. Have you made any changes to your benefit plans in the last 12 months to manage your costs? So your options are: we designed our plans completely. Yes, we changed contribution strategy, made slight plan designs, or not yet. We're considering it, or no changes at all made. So I just want to get a temperature as to how active people have been so far. While you're answering that question, what we did see in the marketplace is through COVID, most nonprofits and for-profits were looking to have things stable. And then once we exited the COVID pandemic, we saw employers being more open to changes. So we're seeing that now, and it's expanding. So let's see how our poll turned out.
All right, ending the poll.
Yep. So no one's redesigned things completely. I'm going to talk about one way to completely redesign, but you haven't done it yet. But you have done a lot of slight changes, some contributions. Many people haven't made any changes at all, or they haven't and they're considering it. Okay, good timing. So let's walk through some ideas, Blair. Go to the next. So we could spend hours on this, but we just wanted to sort of check a few boxes for you and make sure that they taught us in law school. You don't need to know the answers. You just got to know that there's a question. So we're just trying to plant these seeds. And if these ideas don't sound like something you've heard about before, talk to your advisors about it. So we're just trying to throw some ideas out there that we've seen out there so that you know they're there. So number one, tier provider networks. Recognizing that the same services cost different amounts across providers. We'll walk through that in a moment. We're going to walk through health savings account integration and compatible plans with this. We'll talk about right here spousal carve-outs. We have a lot of discussions there. If you find that the spouses are really driving your benefit costs, you might consider providing incentives to employees to go on spouse's plan, or spouses to not come on your plan. HRAs, we're going to talk about as well in a moment, health reimbursement arrangements. And then we'll probably, I don't think we have a separate slide on it, but I'm going to address ICRA, a brand new concept out there that if you haven't heard about, you should at least know about. And then finally, down below, what you start with is benchmarking. You want to benchmark not only your demographics, types of employees you have, but you want to benchmark the kind of plan designs that you have, the deductibles, the copays. How's that compare to other nonprofits or other organizations you're competing with for talent? Are you maybe overly rich in some areas and not as rich in other areas? What are the levers that you can pull? Whether it's prescription drug copays or co-insurance, there's all sorts of levers out there on plan design. In order to know what you can pull, which levers without becoming non-competitive, you got to do benchmarking. And so to the right, you see a little graphic. You want to have your advisors pull your data and compare it to other organizations of your size and your geography, and go line by line through all the benefit components to see where you are today and where you have opportunities to change in the future. Let's go to the next slide, Blair. So let's talk about HRAs. If you haven't done this yet, certainly it's quite common with organizations these days. The idea is to simply raise deductibles to lower premium. And then you offer to reimburse employees and their members tax-free through a health reimbursement account. So if and only if employees have services subject to that deductible, you then reimburse them. When I say you, the old days you had to take receipts and write checks to people. Not anymore. It's all automatic now. So you have a third-party administrator that talks to your carrier, or your carrier does it all directly, and they know the claims. They know Erica's going to get a service that's subject to deductible, and you have a plan design flexibility to say how much you're going to reimburse Eric. And so the TPA sends Eric or the doctor directly pre-tax dollars. So it's a very common way to save on premium and take a little bit of risk and self-fund some of that deductible. You can go further than an HRA and move towards what's called a MERP, where you're reimbursing more than just deductible. You're reimbursing copays and coinsurance. You're basically buying a stripped down insurance plan. So the highest deductibles, highest coinsurance and copays, and then you're rebuilding it through a little bit of self-funding like this. So that's another model of the HRA, but it goes even further than what we're showing on this slide. If you haven't implemented a health savings account compatible plan, it's probably time to do it. About 21% of employers throughout the country, employees are enrolled in a HSA compatible health insurance plan. And so nonprofits always want to provide the richest plans they can. And the HSAs often a nonprofit might look at as not perceive it as rich because the deductible applies to more things. Deductibles typically higher, but a increasing proportion of your employee base will expect to have that at least as an option. And then if you have that HSA plan, you can combine it with that HRA idea we just had on the prior slide. Maybe you have a high deductible and you self-fund some element of it and still maintain HSA compatibility. People could still put money into a health savings account and grow it pre-tax and take it out for qualified expenses. So we don't necessarily believe in it being the standalone plan for everybody, but certainly in a nonprofit space, it's certainly appropriate and even best practice to think about HSA compatible plans, at least as an option out there, and then think about how to maybe have some funding, whether it's through an HRA or even health savings account contributions by the employer. So that's certainly an idea. If you haven't done it already, you should consider. Let's keep going. All right, tiering. This is something that's been around for a while. The idea, and this is becoming more and more important now. The idea is that services across hospitals and other providers will cost different amounts. So an MRI at hospital X will cost a lot different than that same MRI at hospital Y. Or if you get that MRI at a freestanding facility, it'll be even less. And so because of this, the industry has created designs that incent employees to go to one provider versus another. And the idea here is one, you can lower premium by implementing this kind of design. People can still go to any hospital they want to in this design. It just costs them a different copay. So you save in premium, but more importantly than that, you're starting to change behavior. And so if you can get every MRI or every outpatient or every lab test to cost on average less, if your group is 50 or more employees, your claims are mattering to your renewals. And if your claims matter to your renewals, then you'll want to have a good impact on your claims. So if you can get the cost of claims down, that's a good long-term name of the game. So what we're showing here in this slide is an example of where we had a nonprofit client that had a plan design with no tiering to start. And you'll see on the top sort of rows, let's focus on the plan liability, 35, 37, 27, those three different tiers. Tier 1 was the least expensive hospital, Tier 2 was the middle, and Tier 3 was the most expensive hospitals in terms of cost for services. Before putting in a tiering design, it was pretty evenly spread in terms of people going to all three tiers of hospitals. But then we put in a design where people could still go to any of those hospitals. It just costs them a different copay amount. And so after the hospital tiering, a few years later, we measured the same data. And if you look down below, you'll see the liability and claims and members, it shifted. People's behavior changed. And so 2/3 of the plan liability ended up on the Tier 1 side. People still went to Tier 3, the expensive hospitals, but at a lower clip and it is in terms of plan liability. And so by doing that, we're able to stabilize claims. And then what resulted over time was, in this case, very low single-digit renewals year after year after year, because we got to the root cause of the healthcare costs and tried to make an impact there. So it can work. Um, I want to talk about, since budget was so important to folks, do we have another slide on cost containment? Because I want to talk about ICRA here, Blair. All right, so let me
Yeah.
talk about ICRA off the cuff a little bit. ICRA stands for Individual Coverage Health Reimbursement, ICRA Health Reimbursement Arrangement. And so what this is doing, it got introduced in 2020 by executive order. There's a bill currently in the House now to further codify it. It's being negotiated by the Senate. So we'll see where things go. But ICRA essentially, if your claims are running poorly year after year, if your renewals are going really poorly year after year, it's a solution that might help. You terminate the group plan. This is a big change. You terminate the group plan and instead you hire an ICRA provider, a software company essentially, and you as the employer provide pre-tax dollars to each of your employees, and they go on this fancy website, and the website knows where that employee lives, and based on that, they will tell them, "Hey, Eric, your employer's giving you $500 a month pre-tax, and you may choose from among all these different carriers and plan designs." And so that software is going to pull on the individual health insurance market. In this market, it's going to pull Harvard Pilgrim, it's going to pull Blue Cross and United, it's going to pull Mass General Brigham, it's going to pull those carriers that offer plans in the individual market. And people are going to buy individual insurance using your pre-tax dollars plus their own to supplement. This makes sense when you want to stabilize your budget year after year because your claims no longer matter anymore. People can buy that from whatever carrier they want that sells individual products. And in Massachusetts in particular, the individual products are quite extensive. And they could pay for it pre-tax, and you as an employer, even when you're 50 and above, you can set it up so it complies with the Affordable Care Act. So in one sense, you're giving employees much more choice than they've ever had before. On the other hand, it's an administrative burden. There's a lot more education going on with this. There's a heavy lift in the year one. Most employers are not doing this yet, but I'm giving you an idea that's on the cusp. It's about 3 to 5% of employers today are doing this. And I just saw some studies that it's grown by 50% in the last year. And I expect when we see the new studies coming out, we're going to see more and more employers looking at this and potentially implementing. So you should Google ICRA, ICHRA, and you can see what I mean. Okay, just another idea for you on the budget side. We get a lot of questions about what's going on with all these executive orders, what's going on with all the impacts to healthcare, how's this going to impact our plans. So just want to take a moment to talk about that. So federalism really plays a part in this conversation. So you have a lot of federal oversight over health and welfare plans, whether it's Section 125 that governs pre-tax treatment of plans, the Affordable Care Act that tells you what kind of plan designs you have to offer in order to avoid penalties, HIPAA to protect people's privacy. ERISA is a federal law since 1974 that governs how we have to document the rules of our plans and claims, denials and appeals and so forth. So the DOL gets involved, the IRS. There's lots of oversight there. And there's federal funding. This is the one part that's been impacting things this year. So federal funding can indirectly impact benefit plans. And we'll show that on our next slide. But before we go to the next slide, in addition to the federal impact, the state, you got to understand that states govern insurance policies. So unless you're self-funded, unless your plan is a self-funded plan, which is subject to federal oversight and not state, if your plan is insured, then the state of Massachusetts and any other state where your plan might be contracted out of, they control insurance, capital I. And so that's why mandates apply in the state where your plan is situs. That's why departments of insurance can roll out rules and control rates. It's why attorney generals can get involved and act in whichever way they deem appropriate to try to either attack or protect certain benefits. So it's important to understand we have this federal concept here. We have federal oversight of some things, but then you also have state oversight of insurance policies. Okay, so if we look at under that context, if we look at the next slide, you'll see that we have a lot of activity this year. And prior, so you all might remember the Dobbs case where constitutional protection of abortion was removed. And so what did that mean? That meant that the states were then open to pass all sorts of rules and laws. And so we saw actions and continue to see actions on both sides of this debate. There are some states that are outlawing certain types of abortion and coverages related to it. We have other states that are aggressively protecting that benefit, even offering travel benefits to employees in other states that don't have protection to come to states that do have protections. Then you have carriers that will say, all right, well, we're going to cover it wherever it's allowed. So that's an example of where you can have the federal impact in the courts, and then state legislative impact, as well as state administrative policies to help protect or attack certain benefits. Similarly, in these executive orders that we saw, gender affirming care, this is where funding comes into play. So there was executive order linking federal funds to the limiting of gender affirming care provisions. So this was a big step, and so 17 states got together and were attacking this position on the federal side. Massachusetts was one of those states, and you should know, being Massachusetts based, we have one of the more protective states in the country. So where these federal rules are coming out, they can be scary, but know that your elected representatives, as well as the on the legislative side, as well as the administration side, have been pretty active in helping to counter what's going on the federal side and protect certain benefits that those parties feel is really important. I try not to make any of this political. I'm just trying to outline the different parties and how they interact with each other. So we saw in Massachusetts protection of certain care that I'm outlining on this slide. And we'll see it back and forth. But if you're playing a situs in Massachusetts, you're generally protected by the laws here. Okay. Another element that we see out there impacting healthcare is private equity. So we saw this in Steward. Private equity firms are increasing in their ownership of all sorts of entities, including us benefit brokers. But provider groups, hospitals are also included in the private equity realm. So what I talk about with folks about private equity is you got to understand their goals. It's largely bottom line, and most private equity firms understand that some of their portfolio investment companies will not survive, and they understand that going in. The issue is when they get involved in sensitive types of industries, it can have a real social impact. So when they purchase hospitals like they did with Steward, and that is allowed to fall apart, that has much more of an impact on our communities than if, say, they bought a biotech company that didn't make it. You know what I mean? It's a broader impact, and so we continue to we saw that with Steward, and as a result, again, in this particular state, you saw the administration and the legislature taking quite a bit of action to both try to find landing spots for those hospitals that were going out of business, and then also legislatively to put in rules going forward to try to monitor and in some ways perhaps restrict the private equity role in the purchase and running of health entities like this. So that's another thing that you'll see in this state, not necessarily in other states, but you certainly see it in Massachusetts. So what do you do with all this information? Couple things that we recommend. Number one, you got to make sure you're complying with all the rules that are out there already. So the Affordable Care Act, You want to make sure you're complying with the filings every year. We have clients from time to time, new clients, they haven't done their filings, and it's a real process to fix that. So if you're over 50 and you got to do your filings, make sure you stay ahead of that. Same thing on paid family leave. Make sure you're compliant with that. Make sure you're compliant with classifications of employees. Your summary plan descriptions, whenever we see a DOL audit, the first line in their letter is show us your plan documents and your summary plan descriptions. These are not generally created by health insurance carriers. So that's a common misconception. You have to create them yourself. So you want to make sure you have those in place. And what we would recommend is proactive compliance reviews. So don't wait till you get a letter from a government entity. Engage your partners in the benefits industry and HR industry. Engage your partners, have them do a proactive compliance review for you and outline everything that may be missing and fix those proactively. So when you get that knock on the door, and it usually comes from a general audit or it'll come from a disgruntled employee that calls someone in the government and then they initiate a review. So you want to make sure that you are proactive about making sure that you'll be in a good place if and when that call comes. Okay, let's keep going. Fractional HR. So this is another. Everyone mentioned budget. So what we're seeing increasingly, especially since COVID, where folks were open more to remote work, remote servicing. Um, Small HR staffs, tightened HR staffs, HR staffs that are they might not be able to hire another full time, or they might have to lay off some folks, but they still have to make the ends meet. They have to make sure that the trains keep running. We see a large increase in the use of fractional support out there. It's fractional everything, fractional CFOs, but we're talking about fractional HR in this case. So fractional means flexible part-time. It could be project-based on the HR side, on the benefit side. It's often remote. Sometimes it can be on site, but since COVID, employers have been much more open to remote, which allows you to open the spectrum of options for yourself in terms of support. So if you don't have enough HR, but you still have work to be done, or you can't focus on the things that you want to focus on, but that's where this fractional idea seems to be taking off. So it could be simple as COBRA administration, but it could be ads and terms. It could be employee engagement, other types of administration. If you go on to the next slide, Blair, we talk about a few other areas. So it's technology. Nonprofits have been a little bit slower from our perspective than we've seen from other organizations in engaging HRIS systems. So if you haven't done it already, or you feel like you want to do it, but you don't have the time or the manpower to get it done, that's another area that we see fractional support being a way for you to get more done with less. So it's tech, it's HRIS, it's compliance, and project management, especially if you're implementing one of these ideas that we're talking about that requires more effort. AI, there's a question on AI. I'll talk about that before we get to wrap up. It's really interesting you bring up. The question is, can you discuss AI's impacts on benefits and HR, where we think it's going? AI is certainly here to stay. What we see in the benefits and in an HR perspective, we see a lot of it in drafting communications, drafting documents, drafting policies. It seems to be really well received in that realm. Where people want it to work, but where we don't see it quite being there yet is in some of the employee engagement as well as the technical work that gets done. What do I mean by that? So employee engagement. We've run some pilots and have explored, does it make sense to have this bot answer questions for employees about their benefits and HR questions? Can we lean on that more and have less HR headcount? The trouble we've had is that the tech is not quite there yet because, in my opinion, it needs to be almost 100% correct. 80% doesn't do it. So if it answers the questions correct 80% of the time, but then 20% it's like not quite right. That's unacceptable for most HR and benefits people. So that's where the trouble we have so far. It's not quite there to just let it go and not have oversight. If you're going to use it for employee in direct engagement, there needs to be oversight by you, your staff, to make sure those questions are being answered correctly. Otherwise, you run the risk of some serious liability by answering questions wrong. So that's one area we see it. It has potential, it's just not right enough at the time. The second area that we see it is on the analytical side. So on the benefit side, we're talking about, and this would apply to HR, spreadsheet work, analyzing plan options, putting together presentations as a result. Again, it's almost there, but not quite. Meaning, you have to evaluate, all right, well, if we put in this AI-driven system and we have it do some of that analytical work for us, um, is it going to cause us having to do more work to fix the issues in that resulting product than it was worth having them do it in the first place? So that's another pilot that we ran where we found the work product required so much manipulation that we were losing some of the value. But that in that case, that was more about us wanting the level to be really, really high. If you're willing to water down some of that, and you're willing to like live within the box, there's certainly opportunities to do that and to leverage AI in the HR benefits field when it comes to analytical work. Okay.
I think one more thing to add on to that would be with policies though too, because you want to remember that anything that you get back from an AI tool is going to be based on the person that's asking the question. So there's possibility for bias in that. So if you are, have an unconscious bias where you're, typing things into your chat GPT and they're forming their answers based on you, then it's a possibility that there's hidden bias there. So it's always best to double check your policy work as well.
But we're finding a lot of value in the help in the review of writings, in the review of emails, in the review of policy work, or at least getting a template to work on from. A lot of value in that. Even note taking. If you are going to do note taking through systems like this, Zoom or Teams, just going to make sure that you set it up so that it's compliant with HIPAA or any other rules that your organization might be subject to. So there are easy steps you can take to ensure that the system you're using does comply with those rules and isn't spreading individually identifiable health information outside where it should. So if you can do some protections, I find that note-taking feature across systems, that AI-driven note-taking has been quite useful. Last question we have here before we wrap up is increasing vacation time benefits. How does payout work when company provides unlimited? You want to take that, Blair? You want me to take a shot?
Yeah, if you want to go for it, that's good. I can always
Yeah.
have it.
So the vacation benefit discussion continues to evolve. It's been similar where you have on one side, let's just do unlimited paid time off and make and offer complete flexibility to people. And then you have the HR consultants that then say, yeah, but if you do that, not only do some people perhaps take advantage, but more often you have some people that don't take enough, which was the unintended consequence of having unlimited vacation, that they don't feel like they should go out. Whereas you have a set days amount, they feel more compelled to use their time. And the idea is we want them to use their time. So we still see that that sort of tension between paid time off in pieces versus unlimited paid time off as being an area of concern. And then as when we have virtual work. That's the other thing that's complicated that the HR side when it comes to paid time off, because then you have people saying, well, I'm going to be away, but I'm sort of going to be working. So there has to be more policy definition on what does it mean to be working remotely? When is it working or when is it not? And then when you're saying you're not going to get paid for something, they need to be off the clock. They need to not be checking emails. They need to not be on their instant messaging system. So the virtual work flexibility, while it's been a blessing in a lot of ways, it's caused a lot of complications. And regarding vacation time, that's another area that we see it requiring more definition in the policies. Okay, Blair.
All right, so moving on to our last section here. So we covered a lot, but it really all boils down to alignment, intentionality, and adaptability. So whether you're expanding or trying to preserve services through a tight year, these strategies can help you support your staff while staying true to your mission. So some key takeaways here are aligning your benefits with your mission and values, as we talked about, letting staff feedback guide benefit design. So making sure you're taking all of the feedback from your employees, using data to inform your cost saving strategies. So using your claims data if you have that, using survey data if you have that, benchmarking data, all of these things are really important when trying to come together with a strategic benefits plan. Staying proactive on compliance is going to help your budget. You're not going to run up against any violations, fees, anything like that. Using a mix of traditional and non-traditional benefits for high impact engagement and lower cost employer costs is important as well. And then tailoring your approach based on your team demographics can make your benefits dollar go a little further, and leaning on your outside partners for scalable HR and admin support. So making sure that you're allowing the people that you're working with to do their job the best with it.
I see a couple comments going back and forth. Please keep it up. It's great that you have this community to share ideas about vacations. If people want to talk about vacation policies, certainly can reach out to us through your mass nonprofit network. We could talk further about that, but keep going, Blair.
Yeah, so the last slide here is just what you should do. So start small and build momentum. So you don't need to do a full overhaul to start moving in the right direction. A small pilot benefit, a survey, and a strategy review can uncover insights and build buy-in. So you can use these steps to start building a benefit strategy that's more sustainable, aligned, and impactful. As Eric mentioned, it's okay to use a multi-year approach to benefits, and oftentimes it's the best way to move forward. If you make too many changes at once, it can be negatively received by employees and cause undue disruption. So take it slow, but always remember to know what your next move is. So there's some just some ideas here to help build momentum and move forward in your benefits journey. So we've got one last poll question, and then we will kick it off to questions. I know we answered a few questions in between, but if there are other questions afterwards, we'd be happy to take those. So this poll question is, how helpful was today's webinar in giving you practical ideas to support your organization in uncertain times? So please be honest. We take all of our feedback and we try to be better as a result of it. So any feedback you can provide is always going to help us and help you.
And as we're waiting on that, just want to thank you all for taking the time with us. Thank you all for all the work and commitment that you have with your missions. It's more important than ever that our nonprofits stand tall, stand strong, and are supported. So we thank you for everything you do.
All right, I think all the answers are in, so I'm full.
Thank you.
Thank you.
All right, so going on to the next here. Any questions? Anything, if you'd like to take yourself off of mute, actually, I don't know if that's a possibility and open it up, or if you'd like to add them in the chat feature, we'd be happy to get to them.
I think we're good. I think we answered questions as they came in.
Awesome. If you'd like to follow us on LinkedIn, you'll see updates about our webinar series that we have internally, and also we'll keep you up to date with any compliance items and benefit items that you might be interested in. So clicking on the little LinkedIn logo will bring you to our LinkedIn page. And thank you all so much. We appreciate it.
Thank you to the speakers. Have a great rest of the day, everyone, and keep an eye out for the recording of slides.
Thanks, Claire. Take care, all.
Thank you.